have three great panelists with us today, and we want to make sure that the majority of our time today is going to be dedicated to hearing their stories as they talk about their journey to pursuing graduate school. So first, just want to give a disclaimer that obviously the content of this PowerPoint and the things that we're saying today are a reflection of Global Health Technical Professionals, which is supported by USAID, but we are not intending to speak on behalf of the agency, USAID, or the US government. So just wanted to give a brief snapshot of our agenda for today. We're going to be doing an introduction. Then we'll go into just a few key questions that you want to think about asking yourself as you think about whether or not it's time for you to pursue grad school. And then we'll go into our panelist questions. And then with the time left, we want to make sure that you get the opportunity to ask questions of our panelists. So first, we just want to give a brief background about what USAID is. So USAID is the US Agency for International Development. It operates in over 100 countries around the world. And it's basically the US government's arm for doing international development and humanitarian assistance work. And because this is a GHTP program, we want to make sure that you know who we are as well. So GHTP, or Global Health Technical Professionals, is a USAID-funded program that's designed to connect diverse global health talent with career opportunities. So we recruit and support early to mid-career professionals across a wide variety of technical areas within the field of global health. And specifically, we want to highlight our Future Global Health Leaders program. This webinar is a component of that program. So we are very much interested in making sure that as a program, we can help the agency diversify its workforce. And part of that effort starts by making sure that we are connecting undergraduate students who are interested in careers in global health to career resources to really make sure that if you have a strong interest in global health, wherever you are in the country or the world, that you can get connected to our tools and resources and webinars like these. We also have a toolkit that we share in addition to networking opportunities. So we encourage you, if you haven't already, to make sure that you're signed up for our Future Global Health Leaders listserv specifically, so that you continue to get announcements about future opportunities. Again, this is a part of a series, so we'll be doing 4 this year, and this is our second one. So I do want to just pose a few key questions to ask yourself when you're thinking about graduate school. So first question is, why do you want to go to graduate school? Is it to increase job opportunities? Is it to increase your earning potential? Is it because you want to shift the technical area that you're working in now? Just thinking about the why as your starting point. Then the next question we encourage you to think about is, why do you want to do this now? So have you reached a plateau, in your current role, and the next step means that you need to pursue more education? Did you land a job that's going to help you pay for a graduate education, and that's why now is the right time? The third question is, in what geographic location is it important for me to be in? So do you want to pursue grad school in DC because that's where you want to build your strongest network, or that's where you want to find a job eventually? Do you want to go to school outside of your country of origin? All things to think about. Number 4 is, what kind of learning and student experience am I seeking? So are you interested in pursuing an online program? Are you interested in going part-time? Are you interested in pursuing programs that have an international practicum as a requirement, as a degree requirement, or other kind of like experiential learning requirement? And then lastly, one of the key questions I'm sure for all is, how will I pay for school? So Thinking now, if you're an undergraduate student, is my GPA where it needs to be for me to pursue fellowship opportunities or scholarship opportunities? What sort of ways can I think about, paying for graduate school, whether it's thinking about your current job and what opportunities they offer for tuition reimbursement. These are all some key questions that we hope that you'll kind of have in the back of your mind as we introduce our panelists for them to talk about their individual career story. So we'll start too. I forgot, I neglected to introduce myself. So my name is Stacy Terrell. I serve as the Diversity Inclusion Manager for USAID's Global Health Technical Professionals Program. So we have them in alphabetical order. First up, we have Tisa Barrios Wilson, who's a Performance and Transition Coordinator in the Bureau for Global Health, Office of HIV/AIDS. In that role, she supports Haiti and the Dominican Republic. She has 7 years of experience in research, project design, implementation, analysis, and learning in global health and development. She is also a returned Peace Corps volunteer. She served in Paraguay. And she has her master's in public health, specializing in maternal and child health from UC Berkeley, and bachelor's degrees in international development studies and anthropology from UCLA. Next up, we have Sarah Higgins. She is a communications specialist with the GHTP program staff and a business development manager at Credence Management Solutions, which is a government consulting firm. In her role as a GHTP communications specialist, Sarah generates and publishes social media content across 3 platforms to support GHTP's recruiting, hiring, and support activities for early and mid-career global health professionals. On the business development side, she focuses on growing Credence's USAID and health portfolio's work through research, pipeline development, and outreach. She has bachelor's degrees in international development and French from University of Virginia, and she's currently an MBA student at University of Maryland while working full-time. Next up, we have Zema Mirza. She is a program coordinator in the Office of Country Support in the Bureau for Global Health. She is a program coordinator specifically for the New Partnerships Initiative Awards. So in her current role, she coordinates planning, management, technical oversight, and monitoring of global health NPI project activities. She has 7 years of experience in the implementation of integrated health programs focusing on family planning, reproductive and maternal and child health programs in South Asia and Sub-Saharan Africa. She has her, Zema, she previously worked for Pathfinder International, first based in Dhaka and then later in Washington, DC. And so we will kind of start, I guess, in alpha order, or this order, with the first question, which is, why did you decide to pursue a graduate degree?
Hi, everybody. This is Tisa Barrios Wilson here. So I discovered that I really wanted to do global health towards the end of my undergraduate studies. But that was, it was poor timing. I was at the end of my studies and I had missed out on a lot of opportunities to sort of get to know the field a little bit more. So I decided to sign up for the Peace Corps. Be happy to talk about or take any questions about that to get some field experience. But while I was in that application process, I had a whole year to just kind of hang around, look for internships, look for other job opportunities before I knew I was slated to leave. So I was looking for global health opportunities. I had some family, and I'm from California, but had some family in the Washington, D.C. area. So I was looking here, where I'm currently based, and found an internship opportunity at the office that I currently work at, the Office of HIV and AIDS, through the precursor to this program, the Global Health Fellowship Program. And this was great. I was only there for a couple months, but really it was a great learning experience to know how much I didn't know. And so I did a lot of informational interviews with people who worked all over the Global Health Bureau, kind of understanding what their job was, what their skill set, what made them successful, what they wanted to do, so that I could be so that I knew that I needed certain skills to be where I wanted to be. So a lot of that had to do with some field work that I was going to do in the Peace Corps, but a lot of that had to do with, really understanding data and research and design. And I knew that in order to get those skills, I really needed to go back to graduate school. So I knew that even before I did Peace Corps, that I wanted to pursue a master's in public health, kind of going the more traditional route, and applied while I was in my second year, my final year of Peace Corps. Yeah, so that is when and how I decided that I needed to go back to school.
Okay, we'll have Sema up next.
Hi, everyone. So I'm Sema Mirza, as Stacey had introduced. So I had a kind of a longer break in between undergrad and graduate degree. When I decided to pursue my graduate degree, I was already at USAID at a fairly entry-level position. But at the time, because of so much competition in the global health field, I would say, especially in Washington, D.C., I had already, that was my third position. So I was already 4 years in terms of experience. I had worked in Bangladesh, as Stacey mentioned before, and I had some other international experience as well, and just could not get my foot through the door at, let's say, beyond kind of an entry-level position. So I continued at USAID. At the time I was in the Office of Population and Reproductive Health. My background was, in family planning, although I didn't have my public health undergrad. So I was coming in from a different kind of academic background, but had the kind of the hands-on experience from kind of at an entry-level place in public health. So 4 years in, had a job that was teaching me a lot, gave me a lot of professional contacts and a lot of opportunities for growth and different assignments across different regions and countries within the family planning context. And I knew that I have my foot through the door. The next step was to get a graduate degree to advance, really. So that's when I decided to pursue part-time graduate school instead of going full-time and kind of getting my, stepping away from the job market, and kind of continued to work full-time and did a part-time master's program.
So we'll hear from Sarah next. Sorry, already stepped out of alpha order.
It's okay, Stacey. Hi, everyone. This is Sarah Higgins. Some of my story is a little bit different than the other two panelists, but some is the same. So I studied international development in undergrad, and developed a particular interest in global health later in my undergraduate career. But wanted to stick in the international development and global health field. And so after college, came back to family in the Washington, D.C. area, and applied to a ton of jobs, both through USA Jobs, but also in the private sector, and landed at Credence, which is it's a government contractor with a significant USAID portfolio of contracts. So I applied to a USAID position at Credence, but it was filled, and they asked, hey, would you like to fill the business development role in our corporate office? So I figured, all right, it's a job, and hopefully I can get in some global health experience as I get my footing at Credence. And so Credence is a smaller company, which has allowed me a ton of responsibility on the corporate side of things, and a lot of opportunities to learn about organizational leadership and growth. So as well as to keep my one toe at least in the global health arena. So the experience that I've had at a for-profit company, it made me think a little bit more. I always thought I was going to go get my MPH, and it made me think a little bit more about what other graduate school options might have in store for me. So when I started thinking about my graduate degree, I was considering an MPH. I was also considering dual degrees, MPH, MBAs, and then just part-time MBA programs, and ultimately decided on a part-time MBA program. For my goals and my timeline, I really wanted to stay in the job market. And so decided on a part-time MBA, and decided on an MBA over an MPH, because I had the background in global health and international development theory from undergrad, but I wanted to build my technical skill set of skills, organizational leadership, and management skills, because I've seen through my current role how important it is to have that technical basis of skills when you're managing any organization. So that is why I decided to pursue the degree that I did.
Thank you. So our next question is, how long did you wait between undergrad and graduate education, and why? And we'll start with Tisa.
Great. As I previously mentioned, so I waited 3 years, and that was a year while I applied for Peace Corps and intern, and then 2 years while I was in the Peace Corps. It just felt like a natural progression after Peace Corps. I had a lot of extra time to be able to look at schools and think about my application and everything. So, and really decide on what I wanted to study in. Was the Master's of Public Health the right one? Which school? What were the skills that I wanted? What program could give me that? So, yeah, so it was 3 years, and 2 of those years were out in rural Paraguay. And I knew that that's a very different kind of skill set, and a lot of global health jobs do require you to have a certain amount of experience out in international contexts. So that's why I decided to do that. But I also knew that going back to an office maybe right after that would be a harder transition, and also you lose a lot of skills, gain a lot of other skills, and so I thought grad school would be a nice transition back into that as well.
And we'll go to Sarah next to get back to alphabetical order.
Okay. So similar to Tisa, I began my MBA 3 years after graduating from undergrad. And as previously mentioned, I'm working full-time and doing a part-time degree. So I waited that amount of time. Some people wait less time, others wait for more time, especially before an MBA. But my professional experience has been in a small growing company, which offered me a ton of opportunities that I don't think I would have gotten at a larger firm. So I work directly with our president and some of our company leaders every day, which is fantastic. And I've been able to dip my toe into different aspects of leading an organization. So I'm still learning a ton, which is also part of the reason why I didn't want to leave my current job. I'm still learning a ton, have a ton of opportunity, but after a certain career level, I found that this type of graduate degree, it's either a requirement for some positions, or it just gives you a significant leg up in applying to positions or in positions that you're already in. So I got to a point where, the skills and the credential earned with an MBA, I felt would be really valuable to my current company, and will also just help me to advance my tool set in a way in the classroom, in a way that I wouldn't necessarily be able to do just on the job site.
So I waited a little. I'm not sure wait is the right word, but it was 6 years, 6.5 years almost between my undergrad and my graduate degree. And one of the reasons was I was one of those people that didn't have the best grades from undergrad. I learned through through experience and through doing. I'm very much of that mindset, and that's just my way of functioning, if you will. So I had a very practical need to offset not such great GPA, if you will, with experience, and in that process, that's actually what I wanted to do. I graduated. I feel a little bit older than the other two panelists, but I graduated a couple years after the 2008 recession. So it wasn't by choice that I couldn't find anything relevant to development or to health. It took about 2 years to actually get my foot through the door, and that that too, I had to leave the country. I mean, I chose to leave the country and get kind of experience elsewhere. And so, yeah, 6 years because of just what life throws at you. But in that process, I also use that time to think about, like I think Lisa said, and Sarah also mentioned that what is it that I want to do and what I want to get out of this? This is expensive. Money was, of course, another factor to kind of save up a certain amount of money and to really get into something that I knew would be practical and would be something I wanted. So taking the time to research and all of those things. So all of those factors led to kind of 6 years of waiting. Not necessarily ideal, but things work out, and it is the way it is sometimes.
So our next question is, what can students do now to ensure that they have a successful graduate application in the future? And we'll start with Tisa again.
Okay. So I had a pretty traditional path to an MPH, where I went out and got field experience and had some global health experience, et cetera, before applying for that. But I was a student reviewer for applications for my program, and so got to read a lot of applications coming through. And I thought some of the most compelling ones were actually if you came from a different background or had a completely different experience, if you had communications or you were working in, advertising, or if you were working in something else, and really successfully related why that was important for global health, and having this new skill set or new perspective on things could really add to the discussion in the classroom, to the field itself, to everything. Was something that really stood out to me. I think other things that could really strengthen your application, if you do have the opportunity to go out and work or be in another context, in a international setting, whether that's out in another office or in the field, that really gives you some on-the-ground experience, is really helpful. Learning other languages is also kind of good. It's not required, but something that I think is impressive. And then also, I think we're increasingly, and this is not necessarily, there's a bunch of different things you can do in global health, from communications to, a bunch of things, but understanding data is something that's really important in all contexts. So if you have any sort of prior experience, even doing some like online courses or there's a bunch of free stuff to kind of strengthen those skills. And it doesn't have to be biostatistics or epidemiology, although those are helpful, but being able to understand data and interpret that, I think, is a skill that is really important going into global health. Over.
Oh, all right. So I have a couple of thoughts that hopefully are applicable to, folks looking at a couple different types of degree programs. So my first piece of advice is to start really early in your research, and just start the process early to try to figure out the type of degree that's best for you and the school that's best for you. It sounds like a far way off, but I would say at least a year and a half before you want to start classes at the very least. You're going to have to research programs, program requirements and prerequisites. So if there's any courses, you didn't get in undergrad that you need to take, you're going to need to get recommendations from, supervisors at work and or professors from undergrad. So that takes some time. And then, of course, any entrance exams that you have to take, no matter what those are, it takes time, to study for those and to take them, maybe take them again if you need to. And all of this, unfortunately, it costs a little bit. And so it just takes some time to plan. So definitely start early. Something else for recommendations is keep in touch with your professors from undergrad, and also with any previous supervisors that you've had in your professional life, because whether you're most likely going to need more than one recommendation, and having a variety of recommendations from different professional, your different professional chapters, and also from an academic background is often well looked upon on your application. And then lastly is just having a clear vision or reason as to why you want to get an advanced degree. It's okay if that changes. I think for a lot of us that does change when you go to grad school, but having a clear vision that you can communicate in all parts of your application as well as in interviews is very, very helpful.
I'll echo what Tisa and Sarah said. I think that's really, really good advice. I wish I had that. I was kind of going along with it. But to add to both Sarah and Tisa is that I had a spreadsheet. I had a spreadsheet of everything that I was learning over time because I was taking it slower, and I knew I had about a year and a half. So that helped me organize all the information. So that's kind of a practical advice. So I'd split up my answer to this question. One is that be more practical about what you're looking at, kind of like what Sarah recommended. And the other piece to that is to, increase your personal kind of knowledge and your, just knowledge of what's going on in the world, what area really excites you. If you're looking at inequalities in certain areas, if you're looking at certain intersections of inequalities within health, that's what I was interested in. Those are going to help you beyond kind of the good student things to do, which is to take courses and look at data like Tisa mentioned. I would say having an ongoing kind of conversation with yourself is in seeing that, okay, if this is the area in global health that's going to be the most critical in the future in this region or in this country or in this technical area, and that this is what really speaks to you, then take a note of that and pursue that, because I think that comes easier than some of the technicalities of like researching programs and all of that things. And I think that could definitely come out in your personal statements for whatever program that you choose, if it's maternal health, if it's family planning, if it's something like inequities, for example. I know a lot of programs are starting to focus more on kind of inequalities overall in health, that's a big topic, but I think just to identify which area speaks to you is the advice that I would give myself. So I'm giving that to you now.
So our next question is, what expectations did you have for your graduate program, and do you feel that they've been met?
Okay, so there's never going to be a perfect program or a perfect school that will passively meet all your needs, and then you come out at the end fully satisfied, etc. So I think that a lot of the people that I've talked to that had pretty negative experiences or were pretty dissatisfied with their degrees, I think it's really it's your intentionality going into things. So if you think about it ahead of time, so maybe you don't get into your dream program, or maybe you do, but sitting down and understanding what you want what kind of skills and experiences you want on the other side of that, and then intentionally seeking those out. So if you want to leave and you want to know how to use a programming language for biostatistics, or you want to do epidemiology, or if you want to do about monitoring, evaluation, program design, communications, etc., that you sign up for those tougher classes, maybe even if they're going to affect your GPA or going to be harder in your schedule, that you really seek out those opportunities and those course loads. I know a lot of degrees are very flexible, after your first year and your second year, where you can take classes from other schools or other programs to really customize your course load. And then also researching, going to all those awkward office hours for professors that you really want to work with. If you want research positions, graduate student research positions or teaching positions that you just have to go time and time again, looking people up, going to their office hours, introducing yourself, signing up in those classes, and just really hustling to do that. And so I felt that my expectations were met, but I was very proactive. Like right, you make the list, or and it's important to be flexible as you go along and you discover new things that you're like, oh, I didn't know, I was really interested in adolescent health when I came in maternal child health. But understanding that if you want to leave with a certain skill set that you have, it's not going to passively happen to you, and that every program is going to have pros and cons and good professors and bad professors, and it's really up to you to sort of field that actively.
Yeah, I completely echo that. I think any program that you go into, it is what you make of it to a certain extent. So definitely echo that. That's really important to remember. So I'm obviously still in my grad program, so I'm forming my opinions and expectations right now. So far, it's been great. So my expectations going in were basically to understand how a successful organization is run from a lot of different angles. So, anywhere from the financial, accounting, and funding decisions that an organization needs to make, particularly in global health, but just in general as well, to effective leadership and team management. So it's going great. I'm definitely in an MBA program. I think I have to go the extra mile to make sure that I am meeting my personal goals, thinking about a career in health afterwards. So that is, again, to echo Tisa, it's to go to the extracurricular things, webinars, roundtables, informational interviews with alumni who are in the health space. All of those things, it's your prerogative to do. So working very hard to do that. But yeah, check back in a year and a half.
I have to echo everything that's been said already. I had a policy focus to my program, which was relevant and helpful for me, although it didn't dive into policy. But I walked into the program knowing that I needed the degree. It was very practical. I needed the degree. I needed it in a certain amount of time. I have my networks. I wasn't depending on the alumni networks. Of course, that helps too, but I wanted to capitalize on what I did have. And I went in for kind of a well-rounded degree, which it was meant for professionals already working in the field. So I never dived into any particular area, which is, a good thing and a bad thing. So now it's up to me to take a certain area and go that extra mile, whether that's PhD. I have considered it, although I'm not there yet. Or if that's through kind of practical hands-on experience through again the networks I've established over the last 7 years. So it's the expectations. I wanted the degree, and that expectation was met. I wanted to work on a publication. I'm still kind of working on that, and I wanted kind of a well-rounded master's degree to later dive into something specific. Whether that's through school or outside of school, through the work, kind of through the working world, if you will.
So our next question is, what was the biggest barrier that you encountered when trying to pursue grad school?
Cost. It's really expensive. I will say, coming out of Peace Corps, you don't get paid. It's volunteered, so you get a stipend at the end and enough to live off of, but you don't make any money. But there are different, it's called the Coverdell Fellowship programs afterwards to help pay for grad school if you are a returned Peace Corps volunteer. So I applied to a lot of those, and those range, and they're not just for masters in public health, they're for MBAs, they're for all sorts of types of degrees at certain schools, and they cover, some of them are full ride, some of them are just for part of it. I think I ended up going, from California, so I went with a school with in-state tuition and a couple other scholarships. But I really, cost was the main decision maker when it came to my grad school decision.
Yeah. So echoing the financial barrier, it's definitely the case for my situation as well. But another barrier is time. So I'll start with time. So basically, before starting my coursework, you know, as I mentioned earlier, starting early with your research and professional and personal development is really important, especially if you're working a full-time job. It's hard to fit all of that stuff in. So it can seem like a second job sometimes, but starting early gives you, it benefits you because you're just giving yourself more time. And then during school, doing school part-time while you work full-time is difficult. It's challenging, but it's definitely doable. It's a constant learning process for me, learning how to prioritize, schedule my time, and draw boundaries, with my employer and in other parts of my life to make sure that I have the appropriate amount of time for school. And then financial is really important. These are all really expensive programs. The money part was a huge decision factor for me as well. So of course, everyone will take that into account when you're applying to schools. A specific kind of detail to take into account, when you're making your spreadsheet of all of your schools, is see what schools are more apt to offer scholarships. There are private grants available, there's federal funding available, maybe your employer will help you, but it's really a fantastic thing when, you can get money from a school. And in general, graduate programs, I think in the United States anyway, they're more apt to offer some money, but that definitely differs by school and it differs by degree program.
Cost was also a big barrier for me. In fact, it was one of the decisions or one of the factors that I had to consider in pursuing kind of a part-time program, because I wanted to continue to have my job, which was again in the field, in the global health field, that is, so for me to continue to have a salary so I could actually pay for grad school and save what I can. So that was really important for me. And then of course, when I was in grad school, having a full-time job that was very related to what I wanted to do, and it was more of a career than just a job, that was really, really difficult. I can talk more offline, happy to answer questions on people in the participant list that are actually thinking of pursuing both, because I think it's just a very different mindset and different kind of financial strain and other types of strains. But first is to answer the question, the first is cost, and then second is time when you're actually in grad school. So
thank you, guys. And then the next question is, how do you feel your graduate program prepared you for the work that you do now?
So I feel like there's a lot of skills that I eventually want to use. You're coming out of grad school, and I think for everyone, you're never going to find your dream job. It's very rare for you to find your dream job immediately, and that's fine. Right? You should be working towards something eventually. So the job that I do now does use a lot of the skills that I did learn in grad school, but it doesn't use all of them. And, if you don't, it's like a language, it atrophies over time if you don't use your skills. So I learned like a whole programming language for biostatistics data. And if I'm like losing it because I'm not actively using it right now. So I have to find other ways in different online programs or, to sort of keep those skills alive. But I do feel like there's a couple skills coming out of grad school that, and continuing from undergrad, just like learning how to learn and to be adaptable. Strong writing skills always help. I think for grad school, the biggest takeaway that I came from it is really understanding data. I've said this before, but being able to look at scientific studies, to look at briefers, to look at spreadsheets and really understand what's going on, how to interpret it, in general was the best takeaway. Like how to try to get to the heart of things, to understand what is really going on. And so it did. And I feel like those have been integral in going forward and moving into global health. For that, I've been very pleased. But understanding that I did come out with a lot of skills, and that your current job doesn't have to be using all of them. But if you really want to keep a hold of them, you have to be proactive about using it in other areas, personally.
Yeah. So again, I'm still going through my program and not even at the halfway point, but my degree has already been so helpful um, in what I do on a day-to-day basis. It's really cool to do school while you're working in the sense that it can go right to work the next day and apply what I've learned. So for the business development and business growth part of my job, the skills that I've learned in my program have been effective leadership when you're not in a necessarily a defined leadership role. So I'm still very much a young professional, but I've learned skills that help you be a leader, when you're not necessarily formally defined as one. So that has been really helpful, especially working on a team of about 20 or 25 folks. It's been incredibly valuable. And then organization level strategic growth is really important. I'm at a company that is growing really quickly right now, but we are definitely going through, that comes with great things and it also comes with challenges. So learning about how to strategically grow an organization has been something that I've drawn a lot from my degree program. And then to echo Tisa, the data analysis and visualization tools and techniques. That is something that I do not have a background in. I studied development theory and French in undergrad, so I didn't touch anything really data analysis or statistics in undergrad. So that has been incredibly, incredibly helpful in what I do every day. And then on the communication side of things, in the the global health part of my job, all of the marketing skills and market research skills that I have learned and that I'm currently learning have come in handy.
I have a slightly cynical response to this. So I'll start with the positive part and then maybe the cynical one after. I think kind of specific to the USAID world, what we really do is project management. So we're not heavy on the technical piece other than, certain parts of leadership. So there is that too. But essentially, you're at USAID, we're managing money. So a lot of our work has to do with understanding how kind of the bureaucratic processes work, and everybody has to do it, whether you're entry level, mid level, or kind of senior leadership. Everybody has to know that. So a lot of my time is spent on that. And again, it's not just me, it's also my supervisor and my supervisor's supervisor. So that's one thing that obviously the program doesn't, kind of prepare you for, but it's incredibly crucial for working in global health, in the Global Health Bureau within USAID. I think the degree gives you, again, I had a kind of an overview program of public health, and I think public health is a very wide field. You can, there's so many things and new kind of areas that are coming up within public health that it gives you a framework. My program gave me a framework within which to operate in, and diving into anything really, including policy, which my program had a kind of a piece of, would mean that I would have to now get those skills, whether that's through a PhD or through other resources or through my own networks, if you will. So I think a graduate degree, unfortunately, has become the norm right now. There's a wealth of kind of MPH programs, and the market is unfortunately quite saturated, especially if you're talking about global health. It's a very elitist kind of field. I will be completely honest, and I know a lot of people feel that. So if you're lucky enough to have had certain experiences abroad, and you had that privilege, which I did as well, then you have a foot through the door a little bit faster. But it is a very, very it's an elite kind of group of people that have certain access to certain networks, and you get your programs. You get your foot through the door, maybe through a good program, but there's really nothing I don't think that entirely prepares you for your particular focus. It's a little cynical, but that's really how I feel about it, looking back at my experience and some of my friends and colleagues' experience as well.
Thank you. I see, we have I'll kind of skip that question for now because I see with the time we have left, we have a number of questions that have come through the chat. So I think you guys have given great advice for the undergraduate perspective. So if we have time, we'll go back to that last question. But the first question in the chat that I would share, somebody asked about different kinds of MBA. So if you can think of an MBA, probably this question's for Sarah, what kind of MBA would be ideal for global health? And then one question is about, for anyone and all the panelists, what role might there be for a physician researcher and for radiologist within the field of global health and USAID? Not necessarily related to the grad school, so we'll go to you, Sarah.
Okay. So for an MBA, I would say it just depends on what your goals are. So any organization is going to need any organization that addresses public or global health is, they're going to need effective project management, effective financial management, strategic growth, and accounting function, and data analytics, statistics, and research. So it just really depends on what your goals are. And this is where informational interviewing will totally come in handy, because if you aren't sure how those types of skill sets fit into the world of global or public health, interviewing people who perform those functions at organizations in the field can be really helpful. I personally am focusing on organizational leadership and management because that's what my program offers. But any program, a lot of MBA programs offer a healthcare management track or even a nonprofit management track. And then also I would, if you're into the full-time school idea and are able to fund it, look at dual degree programs because getting an MBA alongside an MPH can be a really, really valuable combination of skills.
We have a question from a current undergraduate student that's looking to obtain a PhD in infectious disease research, but also wants to do work in global health. This person has a lot of research and volunteer experience, but acceptance into these programs has been difficult. They want to know what other opportunities would be helpful into getting into public health. What other opportunities would be helpful in getting into public and/or global health opportunities?
I'm not, in your situation or applying for, especially a PhD in the infectious disease realm, but I can think of, having the experience in the infectious disease kind of world. I know that we have an infectious disease office, and of course with COVID-19 and kind of all the forthcoming funds that we have from Congress to implement some of the work, that would be obviously really, really ideal, I think, if you could show that in your resume. But that's the first kind of thought that I have.
If you're interested in a specific program too, or a couple programs, if you reach out to some of the current students, maybe via LinkedIn, or if you get in touch with their admissions office, maybe even reach out to a professor or two or whatever to kind of understand better what they're looking for in their program or for their incoming students. And then, right, it's very, I feel like, program specific. And so I think those are the right people that you should be asking to understand what experience and what kind of qualities they're looking for to help strengthen your own application.
So somebody asked about how have your international experiences helped you in your current job, since you say it helps you get a foot up?
Yeah, I think that it's just a completely different world in the field and on the ground about having expectations about how things work. And so even being able to think through like how is this going to play out in a really under-resourced setting where you're like, magically, like, we're all going to use our mobile phones to go house to house and do a survey or whatever. But like who, even understanding like who has phones, what about service, what about what if it's raining and the roads are blocked? It's a completely different perception about how you think programs are going to be working. Right, and it's very specific to where you are, but even having a little bit more of an idea of how that works on the ground is helpful.
Yeah, I'd say that given our field in global health is concerning mainly low and middle income countries, the reality on the so-called ground is very different. You are also witness to decisions being made in DC or the UK, depending on your donor, and the implications of that for local staff, including yourself as not local, but if you're working in that dynamic, I think is really important to understand in terms of just really seeing those power dynamics come through. I think if I could put in a little bit of a plug on this while I have the mic, if you haven't seen the Global Health 50/50 report, I think even NPR has a report in terms of like what to look out for global health in the coming years or in the contemporary time. I think there's a lot of issues that the field has to address itself that we don't get to talk about in our everyday jobs, but I think people are starting to talk about it. The media is starting to talk about it, and that is the power dynamics between DC and local offices, between headquarters staff and local staff, and the inequalities between that, the racial inequalities and the income inequalities and the intersections between that. So that's helpful for you to understand, but I think especially as US citizens, doesn't matter what cultural background you come from, have an advantage of a US passport. So whatever organization you're going through, you will have a power dynamic. So if I could also give the other side of that advice to, yes, get international experience, but be cognizant of the power dynamics that you are bringing into your environment. It's humbling. I am Bangladeshi, but I'm also American. So going into a workplace where I had local pay, still I could see the differences in how I was treated versus how other women my age were treated in any workplace, forget the organization that I was in. So that's really important. Go check out the Global Health 50/50 report. It has some really cool statistics. I think this will be kind of the next realm of conversations within the field of global health. That's my little plug.
Great advice. We have a question, trying to pick the ones most related to the grad school question. Somebody got their MPH in 2012, moved to the US 2 years ago, has been having a really difficult time securing a job in the public health, global health field. The person is asking, would they recommend pursuing another grad degree or program, or do you have alternative recommendations on how to secure a position in the field? It's a difficult one.
Yeah, I don't have specific advice for you other than, I mean, I can relate to having a tough time getting into the field, getting my foot through the field, into the field rather, because of, again, graduating in 2010 post, recession. I'm not sure how the field is going to play out given COVID and what we're going to witness in the coming months. It's very much an unfolding kind of place. So if you can leverage any connection network, I don't always recommend kind of blind emailing, but if that's your only access, you can always start there, because having those connections will help you at least help your resume be seen. Sometimes in DC, unfortunately, it is about who can recommend who, right? I'm happy to try and connect certain people. If you do want to see a question that says, can the panelists reach out to, I'm sorry, can the participants reach out to the panelists? I'm happy to help. I feel like once you're in a position where you can do that, and you should, I'm speaking to myself, you should always pay it forward, because many people gave me advice and time, and and that helped. I mean, I didn't get a job for a while, but it helped to at least get interviewed. I think that should be the goal. So I'm happy to help, or connect you with people that may be able to.
Yeah, and just to add on to that, I'm sure you're already thinking about this, but just making sure that your CV or your resume has the keywords and buzzwords and the vocabulary of exactly the type of positions that you want to get into. That's something that it takes a little bit of research on your part, looking at LinkedIn profiles, job requisitions, any articles or news sources you can find that discuss topics in your specific field of interest. But it can make a huge difference, whether you're cold emailing and applying, or you are working through your connections. Unfortunately, in the DC area, sometimes the keyword is the difference between a human reading your resume or not. So having some of those buzzwords in there and tweaking the language for the field and the type of position you're looking for, even tweaking your resume between each position that you apply for, can make the difference.
So we have somebody who's asked a question. They're a college senior that'll be graduating and is concerned about COVID-19's effect on the job market. And they're saying, is this the time that maybe we should go straight to graduate school because of the job prospects? I will say that, I don't think that there are concrete answers for how this pandemic is truly going to affect the job market. So I wouldn't want to put any panelists on the spot about that. We are still hiring. On our website, where open positions are continuing to be filled. Obviously, the work of USAID is work that will continue, and you still need staff to do that, whether they are doing that work at home in their houses or not, as well as the bevy of implementing partners that USAID employs. The work may look different, but there aren't really a lot of answers that anybody has right now about how this will really affect the job market. I will say that there are going to be a lot more virtual opportunities to do, like I know that the Association of Schools of Public Health is going to be doing a virtual career fair coming up. So there are opportunities to really kind of put yourself out there as a potential employee to folks in the public health, global health space. Your LinkedIn is going to be more important than ever, obviously, because if they can't source you at an in-person fair, they're going to be looking at your profile to see what that says about the skills and experience you have for that particular position. So I wouldn't give up hope just yet as a graduating senior, but I don't know that we have the answers right now for what the real impact is going to be on the job prospects for you. We have a question about data analysis and statistics skills that would be most relevant. I'm assuming this is for the job itself, or things that they should be seeking in graduate programs. If anyone wants to speak on that, like programming languages in particular that you all use that might be helpful to look for in a grad program.
Hi, yeah, I guess I can start with that. I mean, it is helpful to at least know one programming language for biostatistics. It really depends on the job. There's a lot of global health jobs that you do not need to know that as well. I think the most important just skill is being able to look at data or a scientific article or whatever and be able to interpret it so that that what it's saying is true, or being able to just interpret data in general is the most basic skill that I think is most important. On top of that, a programming language is helpful. I know that a lot of different organizations use different ones, different schools. I learned Stata, worked for a place that did not use Stata. But if you know one program, it's a lot easier to kind of pick up another one. I know if you're just at home and kind of thinking about it, R is free. So that's kind of a good place to start. Also, just understanding, I think an epidemiology class is really helpful just to understand how studies are set up, different ways to do that, and like how surveillance, global health disease surveillance, all that fun stuff. It's a really helpful sort of skill set to understand as well. And then I think more and more data visualization is becoming really important. I know at USAID we use Tableau, which is a beautiful program. And so and even just using, Excel and Microsoft Word and everything to be able to take data and be able to present that in a way quickly and effectively to tell your story is so important. So those are the key things that I would really focus on. I open it up to anybody else who, I'm sure I missed some stuff, but.
I'll say that I'm not qualified to answer that question. So Tisa, your recommendations are actually very helpful to me. I will add that if you're not a stats person and you might never be, then don't force yourself to go into those. There are very, very, very specific jobs, but once you get in there, that's all you do. You're crunching numbers. You're not necessarily using the numbers for policy making or decision making, because those are other types of jobs as well. So keep that in mind, because every time I think that I need more quantitative skills, which I do, I'm also thinking, well, that's not my strength to begin with. I also want to be on the policy side. I want to manage programs, and I want to be able to interpret the data, as Tisa mentioned, to be able to make those decisions. So that difference is really important. It's kind of basic advice, but it's always something that I think about. For people that are not data oriented, there are other tools that are for front-end users that are not data oriented like myself. So you can always look at, this might come very basic to some people on this list, but in case it's not, I will throw that out there, but you can always look at DHS data. You can actually compile and present data from StatCompiler, for example. It's free, it's user-friendly, it's on the user side. So if you need to look up certain indicators across certain countries or even a region for whatever you're looking at, whether that's family planning or maternal health or WASH or nutrition, you can pull up data really quickly and you can organize it really quickly. You can put it in your graduate papers or in your job. So looking at those types of things that are available and very accessible would be the first step if you're not data oriented.
Yeah, I totally echo all of that. I would say that most jobs you don't have to get in there and use a programming language. There's already people who do that, but just being able to understand it. And also there's all this emphasis on quantitative data, there's also qualitative data and understanding how, interviews and group setting, which is equally as important to understand the why of things. And it doesn't get enough credit. So there's all sorts of, you don't have to be a data person, but just understanding the basics of it is helpful.
That's very helpful. Both of those options for folks. I know we're at time, and I really want to be mindful of you guys' time. We didn't get to all the questions today, and I'm happy to. This is being recorded, so we will send this recording out to everyone who has taken part today. There were a couple questions about our positions and who's eligible and who's not eligible. Our positions, like most in Washington, D.C., do require security clearance. It's not because of a lack of talent or skill of anyone who's not a U.S. citizen or permanent resident. And it's strictly because of the security clearance requirement to sit in that space. We will be sending a resource document that includes information about a lot of other global health positions, and especially those that you can work with USAID programming. There's things like STAR, where you don't have to be a U.S. citizen or permanent resident. You could be a third country national. So we'll be sure to send out those resources as well. And we're really thankful for our panelists today who've also offered up to share their information with those of you who have logged in today. So just want to give a quick thank you to you all. Thank you for joining us, and a thank you to our panelists.
Thank you. Hope this was helpful.
Yes, thank you.
And we just have some links here if you want to get more information about our program. And again, we hope you all have a good day.